Well, today marks 40 years since the Centers for Disease Control published the first report of what would come to be known as HIV/AIDS. According to the World Health Organization, the disease has killed 33 million people worldwide. Today, an estimated 38 million people are living with HIV, the virus that causes AIDS. And in the past 20 years, infections and deaths have fallen dramatically, thanks to awareness and new treatments. But in those earliest days of the epidemic, fear, discrimination, and a lack of understanding of the virus made containing and defeating it all the more difficult. Published on June 5th, 1981, this CDC report described a pneumonia-like disease in 5 previously healthy gay men in Los Angeles. While the disease was a mystery with no name then, the study is regarded as the arrival of the HIV/AIDS epidemic. Dr. Michael Gottlieb published the paper 40 years ago. When your paper was initially published, was there much of a reaction?
Well, people tell me, particularly people in the LGBTQ community, tell me that they remember where they were when they read this publication. And they had an uncomfortable feeling about what was going on. But the reaction of the general public was basically flat. It really didn't make it onto anybody's radar. And it didn't make it onto the radar of most politicians.
But uncovering the origin of AIDS and how it is spread took years. By then, millions of people had been infected. The disease was first detected in the gay community and often referred to inaccurately as gay cancer.
I remember those very first patients as well as I remember patients I saw yesterday. I remember their stories, their faces. I remember their occupations. And I remember how they dealt with this undiagnosed illness that had no cause and no name, with incredible strength and understanding and grace.
It wasn't until 1985 that President Ronald Reagan first publicly addressed AIDS, when he defended his administration from criticism that it had inadequately funded AIDS research.
This is a top priority with us.
By then, more than 3,600 Americans had died from AIDS.
That was a very dark time in our country.
Paul Olson is Chief Communications Officer for GMHC, an organization founded in 1982 as Gay Men's Health Crisis, the first HIV/AIDS service organization in the world.
At that time, our government was not stepping up and assuming their responsibility for responding to this crisis, because it was primarily affecting a community that was deeply marginalized at the time.
Sensing a lack of help from the government, AIDS activists, including a group that disrupted the CBS Evening News in one instance,
the story at home is AIDS, and the television is responsible to cover that,
pushed for change. Along with activism, cultural flashpoints put AIDS into the public consciousness. The death of Hollywood actor Rock Hudson, a gloveless Princess Diana shaking hands with AIDS patients in the UK, and Magic Johnson's shocking retirement announcement in which he revealed he was HIV positive.
The HIV virus that I have attained, I will have to retire from the Lakers.
And in the mid-90s, a medical breakthrough, the development of antiretroviral treatment that turned HIV/AIDS from a virtual death sentence to a manageable disease. Today, more than 2/3 of those living with HIV are receiving that treatment. But the epidemic remains in what Paul Olson calls the last mile. What are some misconceptions, Paul, that still exist today about HIV/AIDS?
I think the biggest misconception is that the epidemic is over, and we still are seeing the unacceptably high numbers of new infections, especially in Black and brown and low-income communities that are disproportionately affected by other infectious diseases.
Where do things stand now since you first submitted that article to the CDC?
There's been remarkable developments in both treatment and prevention over these last 40 years. But today, a person age 25 diagnosed HIV positive and who's able to get on medication right away is projected to have a virtually normal lifespan. And that is a big, big change from what it was in 1981.
Did you think that the medical community would get to that point where you would be able to say that to a patient 40 years after you submitted that paper?
No, I didn't.
The goal of the United Nations AIDS Task Force is to end the epidemic by 2030. They have what is called the 90-90-90 target. They want 90% of those infected with HIV to know they are infected, 90% receiving antiretroviral treatment, and 90% of those who are receiving treatment to have viral suppression to where they can no longer transmit the virus. Now, it's ambitious, but the numbers today are not far off from those targets. But just listening to the doctor there, one of the things that is so credited with helping to change public attitudes on this are those public figures coming out and doing what they did and speaking about it in a way that at the time was considered taboo. So that really does go a long way to changing people's mindsets.
But it changed some of the prejudice because those were people that the public knew.
That's right.
30 years ago, who would have imagined Magic Johnson, so many people like him, still alive,
right,
at the at top form. It just it makes you believe in something greater.
Yeah,
well, it just does.
Progress has been made. They didn't even have a name for it 40 years ago.
Still no vaccine, but the treatment options have been just remarkable.
Yes, a lot of work still to do.
Got to have money though for some of those treatment options.